Let's talk about vision correction surgery, specifically a surgery called PRK. PRK is an all-laser procedure designed to reshape the eye and improve the vision. It's done in a manner that leaves most of the cornea structure intact, so it does have some safety advantages over LASIK. Generally, it's reserved for patients that do have certain features of the eye, such as thinner corneas, a slightly different than average structure of the cornea or map of the eye called a corneal topography, or patients who've had prior surgery before. It does have the advantage then of correcting the vision to the same level of LASIK, but not disturbing the deeper structures of the cornea. However, it does have a more delayed or prolonged vision and comfort recovery process. The surgery itself is done just down the hall. It's a fast procedure taking no more than 20 minutes. Prior to surgery, patients can take a mild sedative pill to help them relax, and then it's all done with drops that numb the eye, so it's completely pain-free during the procedure. During the surgery, the surgeon uses an instrument to remove the cells on the outer cornea. They then apply a laser to the surface of the eye, reshaping it. During this, patients will hear a buzzing noise. They may smell a faint burning smell, both of which are normal. After this, a bandage contact lens is placed on the surface of the eye. It's a clear, protective lens that helps promote the best comfort and vision recovery. The day of surgery, the eyes do tend to be red. They do tend to sting and be a little uncomfortable, and then also the vision does tend to be quite cloudy. The vision recovery and comfort recovery after the surgery does take some time. For 3 to 5 days, the eyes do tend to be fairly uncomfortable and sting. We do provide pain medication to use, a prescription for pain medication, pills that are taken, as well as eye drops that help to relieve that. The vision also is blurry in the healing period. For the first 3 to 5 days, the vision usually is at a level where you will not feel comfortable with work or driving. So most patients do need to take the first 3 to 5 days off of work. You can resume normal activities like getting around your house or taking care of yourself or even watching television, but will need to take it a little bit easy. Eye drops are used in the healing period. The first week, while the bandage lens are on, there are 2 eye drops that are used. We then see patients back at about 5 to 7 days after surgery to remove the bandage lens. By this point, the comfort of the eye will have returned back to largely normal, and the vision will be about 60% recovered. Most patients then feel comfortable with work or driving. Full and final vision recovery does take some time. By 6 to 8 weeks, most patients have realized a good majority of the vision recovery, generally about 90%. But full and final 100% recovery can take anywhere from 6 to 9 months. Ultimately, eye drops after we remove the contact lens are then necessary for 6 to 8 weeks to help the eye settle down. There are some activities that do need to be avoided during the healing period. For the first 3 days, it is important not to get any water in the eyes and avoid rubbing the eyes. So we do provide you with eye protection. For 1 week, it's important not to wear any eye makeup. And for 2 weeks, to avoid swimming pools, hot tubs, and tanning beds. Like any surgery, there are some side effects. The number 1 side effect of PRK is dry eye. The eyes do tend to be dry for up to 3 to 6 months after surgery. Using some over-the-counter teardrops will help reduce dryness. We also do recommend other options to help reduce dry eye. There is a treatment that we can perform prior to surgery. We call that the ocular surface package. It's a 2-step treatment. The first step is a gentle cleaning of the eyelids and eyelashes. This removes any debris that can be built up along the eyelids and eyelashes, helping the eyes produce naturally healthier tears. The second part of this procedure is a gentle in-office procedure where there is a warming and massage of the glands in the eyelids called the meibomian glands. These help produce the oil in our tears, and by performing this, it helps the eyes produce naturally healthier tears. The results of this procedure have been shown to last up to years after the procedure. Immediately after the surgery, our surgeon can place a small blocker in the tear drain where the tears leave the eye. This helps keep more of the body's own natural tears on the eye surface for up to 3 months, as this does last for 3 months and then it gradually absorbs. The second side effect of PRK is glare and halo around lights. Most people experience this for 1 to 3 months after the healing period. After that time, most people have a full resolution of glare and halo. There is a small chance of what's called haze or scar formation after the surgery. Should this occur, it generally does fade over time, but it can cause some blurred vision in the recovery and healing period. It is important to know, as we've already reviewed, that during the initial healing period, the vision will be blurry and the eye will be uncomfortable. But once again, most people within 3 to 5 days will have a resolution of the discomfort, and within 5 to 7 days will feel comfortable resuming most normal vision activities. Our hope is for full vision correction. Most people do achieve that in the long term. There is something called underhealing. Underhealing means that you never quite get to where we intend. Should that happen, another procedure or another PRK, an enhancement, can be performed. This is generally done many months after the original surgery. Also, there is something called regression, where most people hit the final end result, like we discussed, 3 to 9 months after surgery, and usually the results are long lasting. But some patients can have a shift or drift that can occur over time. If that does occur, an enhancement or a second procedure can be done. This could be months to years after the procedure. Finally, when PRK is performed for those who are above the age of 40 or for those who reach the age of 40 later, there is a process that happens around that time called presbyopia, and that's the loss of the near focusing ability. If both eyes are treated for distance at the age of 40 and above, patients will need to wear reading glasses for activities within arm's length. The only way around this is something called monovision, in which one eye is corrected for far and one eye is corrected for distance. Ultimately, though, a big summary of PRK is that it is a safe procedure providing long-term vision correction. The results of the surgery have been shown to be identical to LASIK. However, the healing process is prolonged, but PRK is necessary based on your case because of the specific structure of your eye.